Nasal polyps. So we have two types of nasal polyps. One is antrochoanal and the other one is ethmoidal. Okay. The antrochoanal, it is for children. Okay, so bacha what? Bacha. It is common in children, also in adult as well. Ethmoidal is mostly for adults. Next is etiology. It is due to etiology. It is due to infection. Number is mostly one, a single one. It is unilateral. Origin is maxillary sinus. Then it grows backward to the choana. Grow backward, hang from the soft palate, hang behind the soft palate. Here the size is one big polyp. It is not recurrent. What is done here? FESS, that is functional endoscopic sinus surgery. Okay, and how it is treated is this, and how it is diagnosed. So diagnosis is X-ray. In X-ray we see crescent sign, we also do CT non-contrast CT. Let's talk about the ethmoidal one. So ethmoidal, it is happens in adults due to allergy or many other causes. It is mostly multiple, grape like, small. It is bilateral. So it originates from, as the name suggests, from ethmoidal sinuses. It goes backward, it goes anteriorly. Here one big mass, here small grape like mass. Multiple. Plug in 15 minutes. Multiple recurrence here is commonly recurrent. In both cases we do face. Okay. In ethmoidal we can do also CT histology for treatment, antihistamine for allergy, for allergy, anti-inflammatory for anti-inflammatory name as that is steroids. And then obviously FESS face is done. So what is the crescent sign that can be seen here? As we can see, this is the non-contrast CT scan. Large lobulated mass as the radiograph shows behind the soft palate. Okay, let's talk a little bit in details regarding the previous year questions. The adult polyps, that is nasal polyps, it is also known as writing the full name. The nasal polyps are now known as chronic rhinosinusitis with nasal polyposis. Okay, nasal polyps formed according to Bernoulli's theorem. Okay, so what is actually a nasal polyp? It is nothing but, it is also a previous year question, that's why I'm writing edematous, that it means edematous nasal mucosa outpouch formed by Bernoulli's theorem. All of these are previous year question, that's why I'm writing. In adults, most common is allergic rhinitis, most common etiology. Okay, so management is anti-allergy, antihistamine for allergy, then steroids as nasal spray. Next is decongestant for 7 days. If longer, then leads to rhinitic medicamentosa. Let's talk about here what is the most common cause, that is chronic bacterial sinusitis. Chronic bacterial sinusitis. Then allergic fungal sinusitis. Here in this case steroids has no role. Okay, so quiescent signs in anthroponal, and here steroid is useless. Now the last part is differential diagnosis. differential diagnosis for polyps. So there are some vital things. So I have between polyp and turbinates. I have to do probe test. Here probe passes all around, here doesn't, but here pain occurs, here doesn't, and along with pain bleeding also occurs. In polyp nothing happens. So this is the first one. Then meningocele and meningoencephalocele. The first one is this, second one is malignancy for elders. Actually let's write it like this. Second one is meningocele and meningoencephalocele. Third one is malignancy in elderly. So do biopsy to rule out that. And in children we have meningocele, meningoencephalocele in children. Okay, in infant I have to rule out this at first. So to do that I have transillumination and Furstenberg test and MRI. So I have MRI, I have trans illumination. These are PYQ, this is a PYQ, this word is PYQ. Trans illumination nation positive and Furstenberg test positive. For MRI for polyps.